hammy where maybe it's 80 degrees and, it's easier on the leg than it is playing at 55.
Baltimore Game Day Uncensored pregame show. Let's take a look at the injury report.
Injury Report is brought to you by Orthopedic Associates of Central Maryland. In pain? Contact the experts at Orthopedic Associates of Central Maryland at mdbonedocs.com. Care this good feels good to the bone. Injury Report.
And joining us now, Dr. Ralph Zade. And, Doc, thanks as always for joining us. Let's start with Derek Wolfe, who John Harbaugh said as they went into the bye, he was coming back to practice, and they sounded pretty optimistic. He was there for 2 walkthroughs and then now back out. He hasn't practiced for real since August 23rd. I guess your best guess. He's got a back issue. What do you think's going on there?
Usually these kind of things are a bad back sprain, or like a pinched nerve or something along those lines. Probably not something like a fracture or something that you would need necessarily surgery for. It's, hard in these, in a higher level athletic situation because you're using those muscles constantly. And so a lot of times it feels okay. You might be, obviously they do a lot of rehabbing, and then you get back into like a more high level situation, and you pull those muscles, and it just hurts. And so a lot of these things can be a couple weeks. Sometimes they can even sometimes drag out months, especially in these settings.
I would think, Doc, the thing with the back, and correct me if I'm wrong, but the thing that makes it tough, especially for a defense, a lineman type guy, if you have a back injury, you can't lift upper or lower. So you're going to atrophy down some, because his play is energy level and all those things. So he needs his strength to be able to play. So, not only do you get your back right, but then you've got to be able to start lifting to get physically ready to play.
To recover from a back injury, there's so much that goes into it, like your core, your back, and then even especially lower down, your hamstrings are a big part of it. People get tight in their hamstrings, they lose muscle mass, their quads are a big part of it. And so somebody like him who has to use all those things, even if you don't have one of those things, sort of ready to go, it can cause the whole thing to fall apart when you're going back. So they can be, tricky injuries.
Hey, Doc, give me the grades like for a hammy, like grade levels for a hamstring. Is it 1, is it 2? Is that how they do it? I'm pretty sure that's how they do it with hammies too, because it seems like anytime a Ravens dude gets a hammy, they're out for a long time.
Hamstring injuries, more or less, what we kind of look at is like, is something torn or is it not torn? If something's torn, like at the tendon, at the ends of the muscle, that's a bigger deal because that may or may not be surgical. A lot of the rest of it is more or less just tearing of the muscle in between the 2 ends of the tendon, and that is just, that'll heal itself. Similar thing where these guys are just, you're, especially depending on your position, you're using that so much that it just can take a couple weeks, and can take a few months of rehab, anti-inflammatories, resting it and trying to calm it down.
Hey, Doc, last thing. Patrick McCarry's got a high ankle sprain, and he got hurt in the Cincinnati game, so he's already been out a couple weeks. How long do you think that'll keep him out? And his size, does that affect his length of time out?
High ankles, so usually a normal ankle sprain or a low ankle sprain, if you will, is one ligament kind of on the outside of the ankle, and that usually recovers in 1 to 3 weeks. High ankles mean that ligaments between the 2 bones in your ankle are involved, and that can take usually up to 6 weeks to kind of recover. Sometimes at this level we'll even do a surgery where they sort of artificially tighten up those ligaments. But most of the time, it's like kind of 3 to 6 week range.
Doc, like with Rashad Bateman, having the groin surgery, we had Sean Springs on who had that surgery, when he was playing, and he said, he thought he tore it again, but he was just tearing scar tissue. So talk a little bit about that.
Yeah, so if you're having like a soft tissue groin surgery, you do, your hip flexor muscles, which are kind of in that area,
right,
often tighten up a lot. If I do these surgeries, I tell people for at least probably 3 months, they're going to kind of wax and wane with regards to groin pain and tightness. and it'll almost sometimes feel like they redid it or re-injured it again.
Yep.
Usually at that point, around the 3 or 4 month mark, they'll kind of get through a lot of that scar tissue. They'll stretch their muscles back out, and things will kind of start to feel normal again. But when you're kind of pushing it like that, a lot of times tightness in the hip flexors, scar tissue can be kind of an issue.
Dr. Ralph Zade, great stuff. Thank you so much for your time.
Thank you, guys. Appreciate it.
Baltimore Gameday Uncensored pregame show live here at the Jameson Fan Zone at the Horseshoe Casino. We are with you until 1 o'clock. When we come back, we'll climb the depth chart. We'll go behind enemy lines, and we'll get our first look at the weather with meteorologist Vinny Serrato. It is Baltimore Gameday Uncensored pregame. We're with you till 1, and you're listening to 105.7 The Fan.
Toyota, your hometown Toyota dealer for over 30 years. You're only 20 minutes from the best deals on a new or used Toyota because we're 20 minutes from